So let's take a look at how the skin is going to respond in terms of healings to damage or wound healing here. So let's start with this. So superficial cuts are going to fill in and be replaced by epithelial cells. The epidermis is constantly being sloughed throughout the day. And so as long as the epidermis is the only part that's damaged, we're not going to see a whole bunch of response to wound healing. What we will see is we'll just see the cells being replaced, very similar to what we see on a day-to-day basis. However, deeper cuts are going to be closed off via clots, which are going to be covered by scabs and then eventually filled by fibroblasts, making connective tissue and allowing for the wound to be healed. The blood vessels will expand into the areas that have been injured. As this happens, we're going to go about a healing process until the scab finally falls off. Unlike superficial cuts that do not leave any permanent remnants of damage, larger wounds will leave scars. And if the wound is excessively large, we can get an accompanying formation of granulations taking place. Now, what we have to remember is that scar tissue itself is the connective tissue being embedded within the tissue proper that replaces functional tissue with non-functional connective tissue. And so what we have to think about here is, why are we going to see scars with large wounds but not with small wounds as we go about watching this animation of what takes place in terms of a healing process?
The phase begins with arterioles and venules near the site of injury constricting briefly. Then the vessels dilate, promoting congestion. An accompanying increase in capillary permeability leads to the movement of fluid into the affected tissue. Increasing viscosity causes the blood to flow more slowly, and clotting occurs. Phagocytic white blood cells, or leukocytes, emigrate through the vessel walls into the inflamed tissue, where the leukocytes engulf and degrade the bacteria and cellular debris in a process called phagocytosis. Phagocytosis is part of the immune mechanism to prevent an infection that would impair wound healing. Subsequently, the release of growth factors leads to the attraction of fibroblasts. The arrival of fibroblasts marks the beginning of the second phase of wound healing, the proliferative phase. During the proliferative phase, the focus moves to the building of new tissue to fill the wound space. Fibroblasts are connective tissue cells that synthesize and secrete collagen. They also secrete growth factors that induce the growth of blood vessels through a process called angiogenesis, while promoting endothelial cell proliferation and migration. The fibroblasts and endothelial cells form granulation tissue that serves as the foundation for scar tissue development. Granulation tissue contains newly developed capillary buds. The tissue is soft and pink, and because it is fragile, granulation tissue bleeds easily. The newly formed blood vessels are leaky and allow plasma proteins and white blood cells to leak into the tissues. The final component of the proliferative stage is epithelialization, which is the regeneration, migration, proliferation, and differentiation of epithelial cells at the wound's edge to form a new surface area similar to that destroyed by the injury. By the end of the proliferative stage, white blood cells leave the wound site, edema diminishes, and the wound begins to blanch as the small blood vessels become thrombosed and degenerate. The third phase of wound healing is the remodeling phase. It begins after about 3 weeks and can continue for 6 months or longer. During this stage, final scar tissue is being formed by simultaneous synthesis and lysis of collagen. Clinically, the scar becomes avascular. Scar tissue may achieve 70 to 80% of tensile strength by the end of 3 months.
And so the last thing to look at here is, what about other changes that relate to damage to the dermis and damage to the epidermis because it changes the body morphology. And so it all happens because it changes the tension across the dermis. And so as we start seeing increased amounts of tissue underlying or deep to the dermis, what ends up happening is we start getting a cross-sectional tension force that actually shears the dermis apart. And what ends up happening is that the collagen and reticular fibers start to stretch, and they stretch beyond what they're able to resist. And what this does is this basically leads to pseudo lacerations. We're basically cutting the epidermis, but we're cutting it from the inside out. And what this does is this leads to what are usually referred to as stretch marks. The stretch marks are the areas that were damaged due to the underlying change of tension that lead to very large lacerations and scarring to take place. As tension increases on the stretch marks, they become enlarged. As tension diminishes, as the amount of tissue underlying the dermis starts to drop, they become lax. And because the collagen and reticular proteins have been damaged in those areas, pronounced wrinkling will be seen. Now, regardless of what cosmetic companies may be trying to sell you, there's no lotion that can repair the damage of stretch marks. You cannot lotion away the stretch marks. You can cosmetically cover them up with the lotion, but as the lotion dries and starts to dissipate, the stretch marks will come right back, and you'll have to go about and reapply the lotion again in order to cover up the stretch marks. But the stretch marks are the scar that remains from the excessive internal tension shearing apart the dermis and the epidermis. And it's very similar to what we saw with the scar tissue being developed from the cut in the animation, except that instead of being cut from the external surface internally, we're cutting internally and moving externally in terms of the damage that's being seen.